Greeting, guys. Welcome to my YouTube tryout video. This is a trial video. I'm trying to see how we can best improve on our learning activity. For some time, I've been away from you guys, and we've not done more videos. So to the 2,2 and 2,1 at Cavendish University, I know Mr. Garnett is the one that is taking you in pharmacology, and I was once a student of Mr. Garnett, and I want just to guide you now on how some of the things come. So I've just picked on a topic, asthma, and the drugs used in asthma, and how you need to go about some of the things there. So I'll just quickly run through you this document and see how we can do. I'll make more videos, well explained videos on this one, but I'm just trying out to see how we can do, because of late I've just been teaching on a board and someone is capturing me, but these are record videos. So here we're talking about asthma and pathobiology of asthma, which includes bronchial reactivity, bronchospasm, and inflammation of the airways. So you've known how asthma comes about, and you know how maybe you've been taught in class or you've heard about the disease called asthma. So what happens? So there's that bronchial hyperreactivity, bronchial spasm. You know, in something spasm means contraction, and uh, inflammation of the airways. So airways meaning the airways are inflamed. So that's what happens here. This is what I've been reading on. So we have got two phases: immediate phase of asthmatic attack and delayed phase of asthmatic attack. So this is what happens. So what could be the triggers? Here it's showing that allergens, or someone could be allergic, or this allergen. Examples of allergen could be pollen, air pollutants, animal dander, or viral infection. So what happens? There is a release of it's either mast cell spasmogens and chemotaxins. So what happens now? On mast cell spasmogens, what are these example? Example, we have histamine, LTC4, LTD4, and etc. So this is a smooth muscle of the bronchial under normal circumstances. So when these act on these spasmogens, which are histamine, LTC4, LTD4, and many others that you can talk about. So this is the normal bronchial, and that is the mucosa. So what happens when these act on these? They cause about what we call bronchial spasm. That is on the immediate phase. Then we move to the delayed phase of asthmatic attack. But we have these chemotaxins. These are examples: cytokines, LTB4. Then you have influx or activation of inflammatory cells, eosinophils, monocyte, T cells, which release leukotrienes, cytokines, eosinophils, proteins, etc., which cause here bronchial spasms, wheezing, or coughing. So there is increased of hyperreactivity and inflammation. So this is what happens when someone is under asthmatic attack. There is that bronchospasm, and you've heard most of the people that have asthma, there is that wheezing, which can be an indication of an asthmatic attack, or you know that someone is asthmatic. Then there's also coughing, hyperreactivity, and inflammation of the airways. So let me just go back to one of the things. Of course, it's important to know which drugs are long acting drugs, and it's important to know which drugs are short acting drugs. So for salbutamol is a short acting drug, selective beta agonist. So this is important to know which drugs are long acting, which drugs are short acting, selective beta agonist, which is a short acting drug. It's important to know. So the actions you can read there, and this is what happens. Like I said, I'm just doing a video trial. I'm not teaching like in details. So salmetro there, and this is a drug which is a long acting drug. Yeah, so that is a drug, long acting drug. So, so he since salbutamol reverses the bronchospasm all those things. So it's important to know which class this drug belongs to. So like I said, Salmetro is a long-acting beta-2 agonist. Yeah, so a long-acting beta-2 agonist. So then you have theophylline drug there. So it's important to know exactly about these drugs. So it's a xanthine drug. These, most of the questions you find them in MCQ questions. So here, as you can see, theophylline is showing to say a xanthine similar drug, aminophylline, theophylline, ethylene, diamine. So in case you see anything like this about theophylline drug, remember that any of these could be the answers to your multiple choice. So it's important that you know these details here in case you need this question in a multiple choice question. Uh, just a hint on there. So these, they come exactly as they are. It's just a matter of you going through these videos. Let me go to the slide that I remember. Uh, okay, or just doing okay. So this is a scenario question which says, I think it's where is it starting from? Okay, it's here. Patient is started on drug A. How would A be given? So this is an asthmatic patient that presents to the hospital. If a drug A is needed more often than specified in step 1, add drug B. How would B be given? So how can you know the answers to these questions? It's if that is if you have studied the drugs, and because when this patient is just presenting, you're supposed to know, okay, this is the drug I'm supposed to start with. If this doesn't work, I think we can shift to that. And why? So you know the action and also the mechanism of action. So this is if asthma is not adequately controlled. Step 3, you can see what it's saying. If asthma is not adequately controlled, add drug C. How would it be given? So how would you know that? If you've studied specifically about each drugs. Pharmacology is about knowing drugs specifically, which class do they belong to, the mechanism of action, and how these drugs work. So you can't answer this question if you don't know the drugs. So you have to know each drug independently. If you're talking about pyridoxine, carbaco, or let's give examples. What's the mechanism of action? Why is this drug used in urinary retention? What's the mechanism of action? And all those things. So I'm just trying to so these are the answers to the to that questions. Patient is started on short-acting bronchodilator such as salbutamol, taken by inhalation. So salbutamol, you've even seen the nebulizers. Those I don't know, the nebulizer the devices. Someone will just put on the nose and then they inhale. So that one is done by inhalation. So if inhalation of the short-term bronchial is needed more than once a day, regularly inhaled beclomethasone is added. That's upon the knowledge that you have. If the asthma is not adequately controlled, a long-acting bronchodilator. So you remember, they started with the salbutamol, which is a short-acting bronchodilator. Then here they're saying if the asthma is not adequately controlled, what do? A long-acting bronchodilator, which is Salmetro, taken regularly inhalation, is added rather than increasing the doses of beclomethasone. So instead of increasing the dosage of the drug added in step 2, you now add a long-acting bronchodilator. That's according to the guidance or the protocol. If the asthma is still not adequately controlled, oral theophylline, you remember these drugs, they were there. They were there, which is xanthine, if you remember. Theophylline or montelukast is added, or the dose of inhaled beclomethasone is increased. If the asthma is still not adequate to control, that's under step 5, a regular single daily dose of an oral corticosteroid is added. An example of corticosteroid is the prednisolone. This is what they are saying here on step 5. Step 5 there. Okay, I can't reach down there, but I can only reach on step 4. I can't reach on my pointer down there, but you can go to step 5 there. So let's see if I'm able to reach. No, I'm not able to reach on down there, but I'm sure you're able to read on step 5 there. So thank you so much, and I was just doing a trial video. Let's see how we can make this better. So I think from here I know that I can make more better videos for you. So thank you so much. I don't know if this guideline was able to help you. So know the drug specifically, and I'll be able to guide you. I'll start making more videos for you guys. Thank you, and bye bye.